Hello and welcome to the program today. I'm your host, Neal Howard, here on Health Professional Radio for this Health Suppliers segment. Our guest today is a vascular surgeon with Spectrum Health Medical Group. She's here with us to discuss varicose veins, what causes them, some common misconceptions, and some of the latest in treatments. Welcome to Health Professional Radio, Dr. Jennifer Watson.
Well, thank you, and thanks for having me.
Thank you so much for joining us today. Now, tell us a bit about yourself. You're with Spectrum Health Medical Group. Have you always been a vascular surgeon, or is this something that developed as your career progressed?
So I went through general surgery training first, and then after my general surgery training, I did a fellowship in vascular surgery and ended up here in Michigan, which is where Spectrum Health is located. And I've been practicing here for quite a few years now, and at our vein center, where we treat vein disease exclusively. So that is definitely the focus of my practice.
All right. Now, and we're here today to talk about varicose veins. I can't think of anybody who's never heard of varicose veins, unless maybe they're a child. But even if you're a child, I mean, that's when I first heard about varicose veins, sitting around, listening to people talk about these varicose veins. What exactly are varicose veins?
So you're right. Varicose veins are very common. What varicose veins are veins that are dilated due to insufficiency or failure of the valves within that venous system. And essentially the blood pools there, causing these veins to dilate over time, and then in some cases they become visible, and that's where we term them the varicose veins.
Okay. Now, is varicose veins the more common term for them, or is there some other term that one might use when they're getting a diagnosis or preparing for some type of treatment?
The term that's usually used is chronic venous insufficiency, and that does refer to that specific valve failure and within the superficial system of less than half a second. So that essentially means that the valves are not closing every half a second as they should, and then that is termed chronic venous insufficiency, which is generally the diagnosis that goes along with varicose veins.
Remembering when I was hearing people talk about these varicose veins, it always seemed to be something annoying, something unsightly, and nothing really serious. It seemed to be something that everybody was going to get at a certain age. Is that the case?
So not really. I know a lot of people do think that varicose veins just come with age and they're part of the process, but we now know that it's actually genetics that predetermines a lot of this. So not everyone who ages is going to get varicose veins. There are definitely some other characteristics that make you more at risk for that, heredity being probably number one. The other thing is that while for some people varicose veins don't bother them very much, and it may just be a cosmetic or visual thing, for other people it does affect their quality of life in terms of leg heaviness, tiredness, they have edema, even ulceration and things like that. So there are definitely issues with these varicose veins depending on what the patient's underlying disease is and their ultrasound findings.
So just the fact that you've let me know that they can really be a problem almost at any age, depending on, I guess, your exercise level or things of that nature. What are some of the other misconceptions about varicose veins that we are probably all so used to hearing?
Most people think it's a woman's problem. We hear that a lot, even from other practitioners, that they're surprised they found a man with varicose veins. Actually, it's very common in men. And when we look at our practice, which is a rather large practice, we see about 40% of our patients are male. So it's not the minority at all. So I think that's one of the big misconceptions. The aging issue that you brought up is another one. The majority of the patients we're treating are in their childbearing years or maybe men in their 50s. These are not necessarily all people who are of advanced age. And most of the patients we treat are still working. So this is not all patients within the retired population that I think we sometimes think of.
And you say that most of them are still working. What about these professions that we tend to have? A lot of us do a lot of standing, maybe driving, even sports. What are some of the professions and occupations that contribute to varicose veins?
Anything with prolonged standing or prolonged sitting. So I think classically we think of nurses, hairdressers, teachers, and those also tend to be kind of a more female population. But we see lots of truck drivers, especially long-distance truck drivers, who are sitting all day. In this part of Michigan where I work, it's very industrial, and so there are a lot of people working on hard factory floors, standing all day on the assembly line or in a forklift. and we see those patients pretty commonly. So really any job where you have prolonged sitting or standing without a lot of ability to move around tends to put you at the highest risk.
When you're dealing with someone that's suffering from varicose veins, not to take away from the seriousness of them, but do they always herald something more serious? Is that always an indicator, or sometimes an indicator, or sometimes never an indicator of anything other than the varicose veins themselves?
Sometimes it's just the varicose veins themselves. Really, the only way to know is to get an ultrasound. It is difficult to tell just by looking at the patient's leg whether it's simply one faulty vein or whether they have more going on. But the ultrasounds are very good and very telling of the disease, both within the superficial and deep systems. So I really recommend that if patients are symptomatic, that they have an ultrasound just to see what's going on. And it is not always it's not always a huge deal. Sometimes you can just reassure the patient. They can use compression socks and keep things at bay.
Can you mentioned ultrasounds. Can varicose veins be invisible under the skin? I've always thought that, you see them and that's, I've got varicose veins because you see them. Can they be under the skin invisible until you do further testing?
Yeah, they definitely can, and I've read even up to 50% of the time that's true.
Wow.
I don't know if in my clinical practice it's really that high, but there are definitely patients who have abnormal tributary veins, which is the more medical term for these varicose veins, these branch veins, and you can't see them on the surface. Those patients often present with just a swollen leg, a lot of edema, or maybe an ulceration, skin discoloration, but they don't always have those classic ropey veins that you can see.
So what's basically the treatment for varicose veins?
So the treatments for varicose veins really go a very wide spectrum. They can be as simple as lifestyle modification, compression stockings. There are some medications that can help with chronic venous insufficiency, all the way up to procedures which involve actually sealing down, removing, or destroying these faulty veins. And that all just kind of depends on the patient's anatomy, their ultrasound findings, the symptoms, and issues that they're having.
Now, when I am going to date myself, when I first heard about varicose veins, I was a child. Obviously, there have been huge strides, I would assume, in the treatment of varicose veins, or as you say, this chronic venous insufficiency. What are some of the advances that you're aware of, and possibly that you're implementing there at Spectrum Health Medical Group?
Sure. So classically, all of these veins were removed surgically by things like vein stripping and phlebectomy, and those were relatively invasive surgeries where patients had to stay in the hospital. The post-op recovery was difficult, and there were some complications with those. Over the past 15 years, radiofrequency ablation and laser treatment has sort of taken over where vein stripping used to be, and that is essentially using heat to close down or destroy these larger faulty veins that had once been stripped, and that has been found to be so much less invasive. Patients really recover much more quickly. It's an outpatient procedure. But that's, again, been done for over a decade and really has a strong track record. Even more recent than that are some of these newer technologies like VenaSeal, which is an adhesive that is used to seal down or close the vein, or some of the newer foam injectables that do the same thing. So it's all moving towards more minimally invasive outpatient office-based procedures.
You mentioned VenaSeal. You say that this is an adhesive. How does this adhesive work differently than some of the other methods, I guess, compression methods?
Sure. So when you use the heating technologies, you're actually burning or destroying the vein with heat. So you have to make sure that there's adequate numbing medication all around the vein, which is the tumescent fluid that we use. And putting that tumescent fluid in is the uncomfortable portion of the procedure because it does involve some needle pokes. There is some stinging and burning from the local anesthetic and some pressure, and the patient's leg's a little swollen afterwards from that fluid that's instilled. With the VenaSeal technique, you're using an adhesive glue. It's actually cyanoacrylate adhesive. And what it does is it seals down the vein, so there's no heat, so there's no worry about damaging surrounding tissues. So you don't have to worry about things like nerve injury. You don't have to put this fluid in that you had to do with the heating technologies. So it really simplifies the procedure, makes it more comfortable for the patient, both during the procedure and after the procedure.
In your experience, have you noticed any fluctuation in the cost-effective aspect of VenaSeal as opposed to maybe some other, maybe very necessary forms of treatment?
Yes, so VenaSeal is FDA approved, but it is not currently covered by insurance carriers. So the patients do pay out of pocket in my practice for VenaSeal, as I'm sure they do in other locations. And the reason they usually select to do that is just because they do not want to deal with the needles, the tumescence, and the possible risk of nerve injury with some of the heating technologies. So it's a little hard to do a head-to-head price comparison because the insurance coverage is so different, whereas all the heating technologies are generally covered by the insurance provider.
Now, in wrapping up, Dr. Watson, where can our listeners go and learn more about VenaSeal and Spectrum Health Medical Group?
So for VenaSeal, the best thing to do is to visit www.venaseal.com. This is a Medtronic product, and it tells you all about it. There's videos that you can watch. And then for Spectrum Health Medical Group, we can also be found online at spectrumhealthmedicalgroup.org.
Thank you, Dr. Watson, and I'm hoping you'll return for some future segments.
Absolutely. Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, for this Health Suppliers segment. In studio with Dr. Jennifer Watson with Spectrum Health Medical Group. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.